Welcome to Scan Health Can, the podcast where we explore the crucial role of healthcare supply chain. I'm Dana Trampas, your host. Each episode is a new chapter in the exploration of best practices, innovations, and advancements, ensuring at the end of the healthcare supply chain, we prioritize the most vital element, human life. And understanding the people behind each link in the healthcare supply chain is crucial, which is why I am incredibly excited for our guest here today. Can you tell our listeners a little bit about yourself, your background, and what motivates you to work in healthcare supply chain?
Yeah, sure. My name is Steve Armstrong, and currently I am a leadership coach and organizational effectiveness consultant. But my background is a bit checkered. I was politely asked to leave high school because, as my teacher said, if I'm not doing anything, I shouldn't be doing it there. And I was lucky enough to go down and join the Canadian Army and as an infantry soldier, and spent 22 years serving around the world. Retiring as a sergeant major, and there I was always surprised how much health had to play with the role of being a soldier, and also supply chain, because you can't do anything if the supply chain isn't working for you. You need beans and bullets and bodies. Following that, I spent a few years, about 12 or 13 years, working for Red Cross, again, high impact work around the world in disaster and conflict. And once again, supply chain and health rolled around. About half of my life was about figuring out about hospitals and community health and long-term care and injury prevention through swimming and first aid and the like. And once again, supply chain was, well, if you couldn't do your job without effective supply chain. I've been working in a number of health-related organizations, and now I work with as a volunteer with Citizens. Now, Imagine Citizens Network, which is an organization that's trying to make sure the patient's voice is represented in every aspect of healthcare. At the end of the day, the patient gets what they need, which is healthcare.
100% agree. We need more patient voices at the table. But I want to ask you, why should everyday citizens even care about the healthcare supply chain? How does it impact day to day as a citizen?
As a citizen, as a patient, and with loved ones, and most of us don't really care day to day until we need it.
Yeah, certainly. We don't realize it till it's gone, right?
Yeah, exactly. And COVID was a prime example of that. Even with toilet paper, nobody thought toilet paper was a precious commodity until someone thought that we were running out of it. So I think, to be perfectly frank and honest, most people don't think about it and don't care. They just want to be able to go to a hospital, go to the doctor, go to the pharmacy, and get what they need and come home, because we're kind of spoiled that way. Its system has always worked well for us. And but I have three grandchildren, a teenager and two babies, and I don't really care about myself, but when they're sick and need something, I want to make sure they get the Tylenol, whatever they need, or they need to get the health care they need. So my priority around supply chain is much more attuned to what's going on, because I want to make sure the people that I care for and love get what they need out of the system.
I think it's important that patients have a voice at the table and that we're including them in solutions that we create. But I would love to go back a little bit. You
Sure.
spoke about how you have a history in the military as a soldier. How has that impacted your viewpoints on the healthcare supply chain? Is there anything we can learn from that sector?
Well, I think absolutely. The system that they have may not be technically as advanced as some of the bigger companies, like the bigger drug pharmacy systems, but they know how to move stuff from point A to point B. And I think across the world, in the United States and in Canada during COVID, the military stepped up during the beginning of COVID, and because they are logistics experts, they know how to move people and equipment around the world in short order. So there's a lot of lessons there. The other thing, though, my experience taught me, because I was an infantry soldier, not in the medical corps at all. But what I realized was the answers are always there. There's some corporal or sergeant working in a small office someplace that's probably has an answer that you're looking for. And when we are talking about healthcare, we're actually often talking about super smart, like super technically and professionally brilliant people that operate at an intellectual level that blows my mind every time I have this conversation. But they sometimes forget that you need a janitor to make sure the office can open in the morning, right? So the analogy would be like, where's the corporal and the sergeant in the system that has the answer or seen something that we need to be able to factor in? So I think what I offer, both as potential patient, and lucky my health is good, but as a citizen and with my experiences, how do we level out the information, and how do we bring the conversation down to earth a wee bit, and talk about the patients as human beings, and find the people in the system that know the answer, that maybe might be 10 pay grades below the person trying to solve the problem.
Certainly, and I think the way that we talk about things too, I think in healthcare we're very complex in terminology that we use, and I think most citizens go, "Huh? What do you mean when you say this, that, or the other thing?" So
Yeah.
I think messaging is very important, but I think you touched a lot on leadership,
Yeah.
right? What role do leaders play into the healthcare supply chain, and especially in times of crisis, right? I know that you have quite an extensive background in emergency response. Who's
Mhm.
in charge? I think that's something that we always try to talk about, is who's in charge when something happens.
Yeah, well, absolutely. And I think one of the things I brought forward in the last little while, as I was listening to all these brilliant people talking, and hearing what they had to say about the supply chain, uh, what I saw as an insight was, what you're talking about really is emergency management system. So their terminology matters a lot in this world, and in emergencies, natural and technical and man-made disasters, we apply a system called incident command over top of it, and it's interoperable, and it's a concertina effect, so it grows with the problem and shrinks with the problem. And one of the things I brought up is, really I think what you're looking for is this management system called incident command and unified command systems, where, you know, what you do is you're kind of a clearinghouse for all this information, and then you move sufficient amount of resources around to solve a problem as it comes up. And instead of inventing something new, maybe we should look at an existing system that, quite frankly, is ubiquitous throughout the healthcare system, and hospitals and health authorities and even provincial and state governments. It's how we operate in an emergency. So that's one of the things that a person like myself can bring forward. And I would say the other thing is a level of practicality.
Yeah, yeah,
Like I'm not a doctorate. I don't have a PhD. I've done well in my life for education and experience and stuff. But in another health organization sit on a board for, they were talking about one of their key measurements was going to be time before a patient saw a physician.
mm,
And in that circumstances, I just had an experience with one of my granddaughters. So it was quite fresh and raw a little bit to me in the healthcare system. And I said, quite frankly, you are not where the average citizen is, patient is. The patient only wants to see somebody. They just want to see somebody that can help them. They don't necessarily need to see a physician, a nurse, or a nurse of some sort, or even a pharmacist. Like most people are at the point with the healthcare system is, I just want help. And whoever can give it to me, I'm willing to go that route. So if we are thinking about these high level intellectual measurements, when the average human being is just like, I just need help, right?
for sure. And I think primary care plays a large role into that, into
Yeah.
catching things like you said. Pharmacists, I think pharmacists can catch on to polypharmacy if there's overprescription of this, that, or
Mhm.
drug interactions. I think that a lot of healthcare happens outside of a healthcare facility.
Every time I go to a ScanH meeting and talk about this issue of supply chain in healthcare, like the level of people that are operating and running businesses and running organizations and government are like unbelievable. Like pharmacists that are leading this part of the business is actually quite astounding. But again, I think there's a level of humanity and practicality, I think, needs to be applied to the system and the solution to the problem that may or may not be there once we find it.
Another thing I wanted to chat with you about, I saw that you have a master's in health policy.
Yes.
I know that I don't know how much you use that, but I'm working on my Master of Public Health right now. Health
Yeah.
policy and health management, certainly leadership, but policy plays a pretty big role in our healthcare. And I would love to know what your thoughts and experiences are with that in regards to perhaps maybe supply chain or just in general, how health policy impacts healthcare.
Well, that's a gigantic question.
We only ask gigantic questions here.
That's a huge question. In Canada, a lot of healthcare is policy is driven by government because it's a lot of it's funded by governments. We have a system called public single payer, which is the government pays for a lot of the fees, but a lot, probably 80% or 75% of the actual service delivery is by private individuals and businesses and companies. So we set a lot of health policy in Canada in particular on the premise that healthcare is also delivered by government. Government gets yelled at when something goes wrong. Healthcare policy is disconnected from the actual front line a lot of times. And it's more responsive to a crisis or the loudest voice or someone's, some tremendously sad story that you can generates a lot of empathy. So it's always behind the eight ball, like advance of the crisis, right? So you develop policy in retrospect. You don't normally develop policy going forward. And because in a system like in Canada, where we have 13 territories and provinces of federal government and then national defense, so we have like 14 or 15 healthcare systems, it's so disconnected. So my dissertation for my master's degree was actually in community-based health. Because we leave out the community and we leave out the patient and we leave out the citizen, we design these policies that seem like simple solutions to complex problems.
Yeah.
There's so much constitutionality around it, and certainly in Canada, but also in the United States and other countries, about which level of government's responsible for what. We need to start talking about how we all have a problem and how can we solve it? Analogy back to your comment around emergency management. I've just had this conversation yesterday or the other day about somebody about emergency management. It's when emergency management is lots of fun, especially at the beginning, if you're not impacted by the disaster, because nobody asks you to not do anything. Money is no problem and people are no problem. Resources are no problem. But as soon as things calm down, then an accountant shows up and starts asking you hard questions about, do you really need this? Should you be spending this money? Policy starts layering on after the crisis. So I think there's a conversation to be had around policy. I'm not sure if I answered your question, but
no, you answered it beautifully. I think health
yeah.
policy is very complicated, and so often I think that there's unintended consequences that happen from policy that
for sure.
we don't always talk about. But how can we get citizens more involved? What do we need to do to what's a call to action we can put out there to get citizens more involved, whether it is supply chain or policy or just getting their voices heard? What can we do now?
Again, it's hard to motivate somebody when they don't need it or want it or aren't thinking about it, right? But people start to have community conversations. So for example, I don't think I've long stood on this premise in leadership and also in government and government policy, is that as long as you've been involved in the conversation, when the answer comes out or the solution is announced, that if it's not exactly what you want, you might not be happy with it, but you can live with it. So I think we have to make sure that we're having these conversations so people feel heard and participatory in the solution. And then if it's not 100% what they want, they go, at least my voice was heard and, it's close enough, good enough. But if you don't feel heard, then you're offended and upset and you generally get your nose out of joint and then you cause a lot of trouble. So I think what we have to do is stop the blue ribbon panel solution making and start making sure people are involved in the conversation. Of course, I think they need to have something to respond to, right? So you have to put something on the table. Well, what do you think? But I think there is a place to having people in a room and having a conversation with them. This is what we think. How would it feel if you couldn't get children's Tylenol, but you could get a reasonable solution? How would it feel if someone told you up front that this isn't working properly, we have a crisis, and we're not going to be able to do this, this, and this? So how do you have that level of communication with people so that we don't make assumptions that, well, we can't say this out loud because everyone will be mad at us, or we can't not do this because everyone will be mad at us. And there's this I don't know if ever watched Jack Reacher, the TV show, movie on,
Hmm.
it's a great story. Love those stories. But there they say assumptions kill.
Mm.
Assumptions will get you killed. If we start making assumptions about what people want and think, someone's going to get hurt. So I think we really got to make sure we understand what people want and think. And
Mm.
that's where the community conversation and the citizens conversation, the patient conversations factor into the decision making.
Yeah, I think community plays a huge role just in our health in general, right? It's one of our social determinants of health, as they say.
Mhm.
But how do we know that we're succeeding? Like, if we're putting these things into place and we make sure that the voice, patient voice and community voice is there, how do we know that we're successful?
Well, sadly, we won't until something happens.
Mm.
Like there's a test, right? The final test is hard, and that's when the crisis hits, and people start making decisions, and we start talking, having to communicate to people that the healthcare system is not operating at the way you expect it because of this, this, and this. Short of that, I think it's continually talking to people and making sure that they understand what's happening. Now, my fear is probably too strong. My concern is that people's capacity to listen after an event is minimal. Most people are up to their eyebrows already with inflation and the cost of living and maybe my job or my family. And they've already stopped thinking about the supply chain and the healthcare system. They're more concerned about more intimate things around this, and certainly in the area that I live, there's shortage of doctors and shortage of nurses and whatnot, and labor issues are rising up here. And I live in Calgary, Alberta, so there's lots going on in the healthcare system that people are starting to worry about. And my concern is that people have already moved on to their day-to-day life, and they probably won't pay attention again until the next proverbial sheep hits the proverbial fan, and all of a sudden things aren't working the way they hoped. That doesn't mean we don't do stuff, and it doesn't mean we don't talk to people and explain people. But I think that the window to affect change is quite small post disaster,
Yeah, do you think
post
we'll ever
crisis.
shift from that reactive mindset that we kind of have, right? Oh, there's a fire here. Oh, we got to take this out, instead of being like, maybe we could think about the conditions which created that fire,
Yeah.
right? Can we change that mindset? Can that ever be changed?
Well, Scan H is doing that. Is trying to do that, and I applaud all involved. But human nature is human nature. I learned a political science lesson a while ago, a long time ago, when I first started working for Red Cross, and we were trying to get one of the provinces to fund. I forget what the number was. It was not a very big amount of money in the big scheme of things. Maybe it was $250,000 for cots and some stuff so that we could deploy in case of evacuations and disasters. And the minister responsible at the time, which would be equivalent to a department secretary, United States, the minister said, "Well, Steve, this is a great idea, and I think we should probably try to do this." But he said, quite frankly, I'll get a lot of more political capital standing in front of a $2 million fire truck than I will standing in front of 150 cots.
Mm.
So short-term thinking is what it is at the political level. I have great confidence in generally, and for the most part, in the public service. That lots of people are thinking about this. We will be better prepared the next time, but we will not be as well prepared as we should be because of things like Scan H. But human nature will get in the way of that. So, like for example, in my hometown, where I live, Calgary, Alberta, beautiful, close to the mountains, kind of like Denver. If you're listening from the States, a little bit right along the edge of the Rocky Mountains, and it's a wonderful place to live. But we had this gigantic flood 10 years ago, actually 11 years ago this summer, where it flooded like 100,000 people were evacuated in lots of places. And there and now all of the flood mitigation capital work is being challenged because it's too expensive. Because people forgot what it was like when the whole downtown was shut down because every basement within a kilometer in Canada miles from the river on each side of it was flooded with water. they're still going ahead with it. Thank goodness. I think it's all the right work to do. But the political capital that's being expended on trying to get it done is high. So if we take it to supply chain, there's a point where, yeah, you can affect change easily, and then it becomes hard. And I think we're in the hard phase now.
My last question for you is, what's one takeaway you'd hope people would grasp from today's discussion, whether they're a citizen or any piece of the healthcare supply chain? What is the key takeaway you hope people will have from our discussion today?
There's a good question. You're starting to make me sweat for my answer. Well, I think I would say two things, if I may. I'd say one is there's a lot of really thoughtful, smart people working on this, trying to bring a solution to the table. So if people could only see what's happening, how hard people are working trying to answer the question, I think they would be impressed. And a solution will, some solutions will come and it won't be perfect, but it'll be better. And I think that's the one part of that first part of the question. The second part of the question is, when you take your granddaughter or your granddaughter gets taken to the hospital and there's something missing there, that's not the time to gripe and complain and yell and rant and rave. We need to be more involved at every level. Like, phone your state representative or your member of the Legislative Assembly in Canada. Understand, that when there's a problem is not the time to go running around upset and mad and trying to or panicking. There's a old public policy axiom that says policy made in a crisis in haste is inherently bad policy. So, get involved now. Get involved with organizations like ScanH or Imagine Citizens Canada. Lots of people out there that are trying to make it better. And if what we need is thoughtful, calm, relaxed people involved in the conversation. So when things go sideways and the solutions get applied and they're not the right solution, then I think we all have responsibility to say, I should have been involved. I should have talked more. I should have been in the loop. But I get it. People are trying to buy groceries and look after their children and get them to school and all that stuff. So maybe it's just a place for old guys like me to sit around and gripe and talk about how great we used to think we used to be. But I do think we do need to be better involved and more participatory citizens in every aspect of life.
I love that. We need more citizens in conversations. We need more citizens at the table. Your voices matter, especially how the healthcare supply chain impacts you. Well, Steve, I want to thank you so much for your time today. It was exceptionally insightful. If our listeners wanted to reach out to you or get in contact with you, social media, what's the best way for them to do that?
Email me at steve.stevenarmstrong.ca. Also on all of the major social media. People either went to my website or emailed me directly. So my website is stevenarmstrong.ca. And I'm pretty easy to get a hold of. So just reach out. And I'm open to any conversations about almost anything at any time. And I'm a cheap date. I usually end up buying the coffee. So
That's great. Count me in. Well, thank you, Steve, again. If you're listening, please reach out to Steve and learn how you can be more involved in your voice in the healthcare supply chain. If you enjoyed today's episode, don't forget to share your thoughts and feedback. Until next time, I'm Dana Trampas, your host. Stay tuned to Scan Health Can.